So how exactly does needling work on the skin? Well, I use the Dermapen in my clinic, and a Dermapen is basically a pen that is electric, so you plug it in and it makes a little noise. And you then have a new needle every time a client comes, and this new needle is then inserted in here so that we can of course do the needling treatment. Now, as I can adjust how deep I want to go with my pen or with my needle into the skin. And then as I start doing the needling, the needle is here now, I do small little circular motions to make sure that I make tiny little channels or holes in the skin. Now, if I'm working on something like wrinkles, I want to really get in there. So I've got to see what we call pinprick bleeding. So a little dash of blood, then I know I'm touching the dermis and I'm going to have an effect in the dermis, which is exactly what I want to do. If, however, I just want to work in the epidermis when it comes to treating hyperpigmentation as an example, there I just want to see redness on the skin. So then I'm not going to go very deep into the skin. What I love about these needling pens is that you can adjust the depth. So that means on an area like the forehead where you don't have a lot of skin, it's not thick yet, you don't need to go very deep. And the eyes, you also don't want to go very deep. So you can adjust your pen just to go a little bit into the skin. But on the cheeks, you want to go deep. Maybe underneath on the neck area, you want to go deep. Then, of course, you can make the needles go deeper. Ultimately, what happens is the minute that little needle goes into your skin starts to heal itself. It's now got an injury and the healing process gets kicked in. And that's then, of course, what we see as the rejuvenation about 4 weeks later. But as I make that little hole, the serum that I needle with is important because those active ingredients are going to go deeper into the skin, which, of course, is exactly what I want to achieve. But overall, the Dermapen or the microneedling, which is actually known as collagen induction therapy, that's really the real term for it. It stimulates the cell-to-cell communication, so every process, every mechanism in your skin works so much better. It is rejuvenating by stimulating the collagen production in your skin, and by doing that, we do get that youthful firming. The skin just looks better. It can be done on scar tissue as well, which is phenomenal because it helps to minimize the severity of the scar when it comes to what it looks like on the skin. Everybody can pretty much, benefit from the needling. I won't necessarily do deep needling on someone that's prone to keloid scarring, but other than that, everybody else can pretty much have that.